Hi everyone, hope you're doing well from wherever you're watching this channel, depending on your time zone. Now, the truth of the matter is that in as much workers have not been paid up to now, people like William Ruto, Rigathi Gachagua, Mudavadi, and the entire cabinet, they can fuel their cars in any petrol station and that bill goes to the government direct. So they have no any problem with the transport. These people have no problem to pay their rent because the government is doing so. They get their allowances and they cannot feel the pinch in case there is no salary. But the truth is that, again, they have had their salary. So the question they should be asking themselves up to now, what about that doctor, the nurse, and any health worker who has to work in the morning, get to a matatu, or if they are using private transport, then fuel their car and get to work when they have not been paid? Who is paying their house rent for those who are working within the city and the town once you don't pay them their salary? These are the serious questions that this government is not answering. And because of this, finally, the health workers have downed their tools. They have called for a strike, and this government has only 3 days to either sort out, or on 19th, then workers will be nowhere in all health facilities in this country. That is the situation as of now. And now, the 8 unions of workers have finally come out with a statement. So it's here. 8 unions, including the Kenya Medical Practitioners, Pharmacists and Dentists Union, Kenya National Union of Nurses, Kenya Union of Clinic Officers, Kenya National Union of Pharmaceutical Technologists, Kenya Health Professional Society, Kenya Union of Nutritionists and Dentists, Dietists, declares that their workers will not report to their work station. So it is official. They will not be working. And I quote them. This is what they are saying. We regret to inform you that our members will not be able to attend work as scheduled as of Wednesday, April 19, 2023. Occasionally, delays in salary payment have left us in a difficult situation, in a difficult financial situation. As a result, we are unable to meet our daily needs, including transport, food, and accommodation. Very critical issues. If I have no money to get food to eat, how do you expect me to come and work? If I cannot pay for my rent, then where do you want me to sleep before I come for that duty? If I don't have transport to come to that work, do you expect me to walk to duty? Serious question. We recognize that the provision of quality health care is critical to our nation, and we remain committed to fulfilling our obligation to patients and the community at large. They understand their mandate. Very clear how critical is the health department. We acknowledge we cannot continue to work under such conditions, as it has become increasingly difficult for our members to meet their basic needs. We urge you to urgently address this matter and ensure that our members receive their salary on time to avoid further disruption of services. So, if you read up to the end, they are very clear that Ruto has been urged to address the demand before it is spiral to a full-blown strike. So it means this is just a partial strike, whereby they will not be attending to duty. Hawatakuwa kazini. But now, if it will not be sorted out, then they will be on the street. Sasa hapo ndo tumefika. The question is, who is going to suffer? Is it only the health workers and the civil servants who do not get their salary? Or this situation is touching on everyone in this country? Before we continue, just a quick request for those who are watching and you're not subscribed, please consider subscribing. To our eternal subscribers, I must say thank you so much. And again, to all our viewers, please give this video a thumbs up. Thank you so much, and back to this discussion. Now, the truth of the matter is that health workers, just like any other civil servant, have been hit hard. They are feeling the pain. They have been affected with the current situation we are having as of now. But again, they are not the only people who have been affected. Besides the fact that we have many problems, including high cost of living, now Kenyans are going to face another huge problem. Now we are coming to phase 2 after people missing salary. We were demonstrating about high cost of living. But soon, we will be demonstrating because of disruption of basic services in public facilities. For example, if you have a sick person, how would you get your person taken care of if there is no doctors or nurses in the hospital? Who will serve you in that facility? It means we are going to have problem in terms of health issues. Treatment is going to be jeopardized. So you might end up having a person who need emergency service, but because they cannot access, that person, God forbid, can lose life. So this is not a matter to laugh at or to criticize. It is a serious matter. I wonder how Ruto was able to sort out the security officers and forgot to sort out the health workers. Just like security is a critical situation in this country, it is just same to health workers. It is also a critical situation. Health and security, very important. But instead for him, because of fear that if you don't take care of security, then they can easily just join man. And that means you are removing someone from power. So because of fear, he addressed that one. What about the nurses, doctors? What about them? Pharmaceutics. We are well aware this problem is coming because county government have not been receiving funds from national government. And that's why they are very clear. They are also addressing William Ruto directly. They cannot blame this one on governors. It is not a problem created by governors. Yes, health is devolved function. But then, for the past 3 months, counties have been unable to get disbursement. So how do you expect governors to pay health workers? The other time I saw Governor Sakaja meeting with the workers to negotiate, but then how do you sort it out when you don't have money to pay? So it means many counties across this country, they are unable to pay health workers. And you know, we have hospitals that are under counties, and we have those which are under the national government. Confirm most of those referral hospitals, some of them are under national government. So all of them that are going to be at home. So the biggest problem that we have ever had in this country, it is the administration of William Samoei Ruto. We are seeing a sitting president who want to destroy devolution just by denying them funds to run county governments. Look at that. So it was food. Now it is coming to services. What will be next? Imagine we are in the middle of another month, and despite the fact that Gachagua had said they will collect taxes in within 1 month, one week and pay workers, already a week has been ended, but they are yet to get their salary. So workers are now learning that these people are liars. And this is the middle class we were talking about. They touched the poor, unemployed, and the demonstration was being led by that group. Now they have touched on the middle class. What next? They should not sit pretty. Soon this situation will be beyond control. And once it reaches there will be no two-way for William Ruto. It will just be a one-way. So it is high time for him to sort out the mess. So we are seeing a president who is determined to destroy devolution, who is determined to hold the entire money in this country at the executive so that everyone will become a beggar to get to his office and go there and kneel down for help like the Moi time. We moved a long time from there. So I don't know how these people are going to respect our 2010 constitution which brought in devolution. They must respect our constitution, let health workers get their dues so that they can provide services to Kenyans. Otherwise, we are in a mess.